the CS, if he's not aware, that St. Mary's Hospital is yet to be opened. The people who are getting services at St. Mary's are still suffering. And St. Mary's, this is an institution that was opened 1930. It has a lot of significance in Wangaland, and all of us have grown up using St. Mary's Hospital. In fact, several of my children have been born in St. Mary's Hospital, and another one will be born there next year if it will be open. So could the minister...
You are a very hard-working man.
Yes, I'm sure next year Mama will go there to get a baby. But the hospital is not open. So what will happen? So could Waziri tell us what is actually going on about St. Mary's Hospital? People are really suffering. Thank you, Mr. Speaker, and thank you for the chance.
Robert.
Thank you, Mr. Speaker. You know, NHIF had a very, very bad reputation, and due to its poor management of claims, and the CS has constantly made, mentioned that. But CS, when now you started deducting more money under the new arrangement of SHA, with a system that cost us 104 billion over a 10-year period, we thought that this issue of fake claims and this management of claims would be a thing of the past. Now, recently in a public baraza, you actually were saying that there's a lot of money stolen through the new system, and that you are actually going to take some cases to the DCI. I wanted to just know, does that mean that this new expensive system is not working? And so far, after you took your files to DCI, how many have been convicted and jailed? Thank you.
Honorable Speaker, let me start from the reverse. From my former colleague at Moi Forces Academy, many years, the deputy minority leader. Number one, the system does not cost 104 billion over a period of 10 years. And the government of Kenya is not paying a cent. Because the 104 billion should have passed through this house. So what is there is a fee for service. The system is built, and the Kenyans who use through the Digital Health Agency, then the developers of the system will be paid. Two, and very important, that you have raised. In fact, the fraudulent claims and the facilities that were flagged off, number one, were flagged off by the AI system, fraud detection system of the digital superhighway, and then counter-checked by our clinical review team. As I said, Honorable Speaker, before I came to the ministry, and the SHA is just now 13 months old, the people who used to steal from NHIF went to SHA not knowing that this is a different animal. Honorable Speaker, you'll find a facility saying that there were 300 deliveries in their hospital, and all of them were C-section. That's even against the WHO rule. That is now a fraud. Or there are no birth certification. The system says, the system will check the documentation, or there is no even the legal document of the claim. So the system is the one that, and we submitted close to 118 files to the DCI with concrete evidence. I think up to about 20 plus he has submitted to the DPP. Once it has left me, it has gone to a different group called the Criminal Justice System. Some of them have been taken to court, very senior people in SHA, facility owners. And we will continue. And we have closed 184. And they are about, all of them, they're under investigation. So it is, and this fraud, same fraud is taking place in the medical insurance, private medical insurance scheme, even covered by Parliament. If you talk to Jubilee, if you talk to CIC, talk to them. The same problem SHA is facing is what they are facing. Because we had a meeting with them. In fact, today, if SHA suspends you from their portal, I can assure you 100% that facility, all other private medical insurers will also suspend. Honorable Speaker, there were a number of questions. And you know the first one, let me start with the Honorable Tandaza. I want to assure you that I have the list of all the NGCDF payments available. The list also contains receipts and dates and months. And Honorable Speaker, to be honest to the House, I will table that next Tuesday. I'll make sure the leader of majority tables. I want to assure you, and just to give you a sample, Subukia constituency, between 2024 to 2025, the amount is 156,000. Jomvu, NGCDF, 9,960,000. Chuka Iganga Ngombe, 2,700,000. Mandera West, 3 million. Westlands, 966,000, among many others. And I will table it to the House. And I stand by that. Before the House goes on recess, we will do all the reconciliation. It's now underway, and we'll post the reconciliation indigent list submitted during the NHIF time. We will submit to the House, and we will do it through mean testing, and we will make sure that we abide by the direction of colleague members. Honorable colleague members, from Honorable member for Budalangi, my good friend. In fact, between NHIF and the NSSF, the NHIF and SHA, you should be a very happy member of parliament, like me, as a minister. It's SHA that covers more than 4 women. You have 4 spouses. NHIF used to cover only 1. SHA covers unlimited number of children, as long as you can prove they are your children. So that alone tells you that NHIF and SHA, you can't compare the two. Honorable Speaker, the package, the benefit package.
Yes, Angela, what is it?
I never asked how many wives does SHA cover. My question was...
Order, Angela. It is public notoriety that you have been proclaiming how many wives you have.
But I didn't say how many they should cover. He should answer my question. He should go back and answer my question.
Okay.
That nobody chooses which type of disease, the type of, whether expensive disease or cheap disease. So what we are saying is that SHA should cover everything once somebody is sick. Because guarantees that.
Honorable Speaker, I have been with him for many years in this House. You can see, even when he's asking, he's a very happy man. So he's very happy with my answer that this is a better package. But Honorable Speaker, the benefit package is gazetted and is available. The package was passed by this House. How much is for oncology? How much is for dialysis? How much is for... And if the House, through its wisdom, increases the package, we will. But the package was passed by this House. The package under law is due for review by the Health Benefit and Advisory Panel. And I've taken the concerns of Parliament, and Parliament should also provide the budget. But Honorable Speaker, let me even go a different way. Because many members were asking the differences between NHIF and SHA. For surgical tariffs, across all providers, any surgery, they are unstandardized across all the providers. Before you could go to a private hospital, they charge you a different amount that is charged in the faith-based, that is paid for in the private. But now we have said any surgical procedure, whether it's you go to Aga Khan, or you go to a county hospital, or you go to a faith-based hospital, it is standard. 2, the tariff limits have been increased by 12% under SHA. And I want members to look at even the law we have passed. Every tariff, every benefit tariff have been increased by 12%. Under NHIF, the limits were different for different facilities. Different hospitals were charging differently. And Honorable Mama Degorot, Beatrice, let me agree with you. Healthcare is very expensive. And it depends on which hospital you choose. So you must be very careful which hospital you take your patient to. There are hospitals, private hospitals in our country, that if you stay for 5 days, you get a bill of 11 million, when it should be 2 million. I have concerns. So I think in previous parliament, we have discussed the cost of healthcare in our country. Before this House, Honorable Speaker, my committee, led by Honorable Dr. Nyikal, is looking at quality care and patient safety bill. I think we must do amendments to that law to deal with the cost of healthcare in our country. In other professions, lawyers, their costs are regulated. We must regulate as a country. I'm sure those who are doctors who are in this house and the ones who work with me will not be very happy, but we have to say it. The difference between NHIF and SHA, emergency evacuation will soon be launched. There is the ECCIF. Once we do the emergency evacuation, the ambulance will be paid for by SHA. The first 24 hours will be paid by SHA. That never used to happen under NHIF. All Kenyans now will have an access to an ambulance. The days when a patient is taken to a hospital on an emergency and you are asked for deposit is over with Social Health Authority. These are the benefits. SHA will pay for the ambulance. SHA will pay for the first 24 hours. The only package that I think the feedback we got, and we get a lot of feedback. We have a call center, 147, that every day over 5,000 to 10,000 Kenyans call. We get feedback from leaders like you. We get feedback from citizens on their concerns. But the Social Health Authority, the Social Health Insurance Act, the Primary Health Act. Let me tell you the biggest difference between NHIF and SHA. And this is now where I should want to thank this House and the leadership of this country. Primary health care paid by the Exchequer at level 2, level 3 and sub-county hospital is free. You walk in, you walk out. Now let me come to the question of my sister, Samburu West. Yes, if you ask me, if you put a question on those who are co-charging, I will provide. But I think complimenting the ones who are doing good work, I think I'll do it. You know, it's members who oversight. Mine is implementation. But I agree with you. It is criminal, it is unethical, it is immoral for when this House has appropriated resources for Kenyans who access outpatient through the primary health care fund. And the money is supposed to go to the facility as capitation. You're asking Kenyans to buy exercise book, to pay for laboratory. Mr. Speaker, that is immoral, it's a constitutional criminal even in the law that you have passed. And I think a time will come when we shall shame those facilities and in those counties, whether even my referral hospital, if they charge extra than what is provided. On St. Mary's, Honorable Speaker, even if I was a resident of Kakamega, maybe my children also could have been born there. But let me make it very clear, Honorable Speaker, I've even given you the data as one of our leaders. St. Mary to date, SHA has paid 114,548,896. The claims which are with us, which we will pay in November, which is this month, is only 5.5 million. I went to Kakamega myself. I sat with the whole team, our Lord Bishop. We sat with the whole team, the bankers, the SHA team, we reconciled, we did a press conference, but that is a faith-based facility. I cannot go and open it. Now that I have given you the amount of money, the one for NHIF is a legacy debt, just like Consolata Madari Hospital. Honorable Speaker, St. Mary has become a political hospital. I cannot go and open. I am ready to go with you, but I told the Lord Bishop, when you're opening, call me. I'll even bring extra drugs from the Ministry of Health. We're waiting for the day to be opened. So let me send my good brother, please, 114 million have been paid by SHA. 5.5 he will pay. The reason why it's not being opened is beyond my control. It's the way if Nairobi Hospital today closes, and I have paid them the money, and maybe they want to go and open a hotel, there's very little I can do. Honorable Speaker, so St. Mary, that is the case, but we are, as a Minister of Health, we are working, and I really want to ask both Professor Undo and my brother Kipagendi that I need to get the details of those two patients and see those particular hospitals. We have hospitals that also want to co-charge people. They don't want to use the right tariff. It's called decoding. But I'll ask Mercy and myself, Honorable Kibagendi and the professor, just share with me so that we check from the system, and if we feel there is a problem, we will go resolve it. It's part of the feedback we want. But we are working on to reduce the cost of healthcare. Number one, by introducing reforms in the KEMSA, making sure we do bulk procurement to reduce the price of drugs. We want to do contract manufacturing. We want to do strategic purchasing by SHA. And that's why we also introduced the NEST program, where hospitals don't need to pay for equipment, neither the county or the national government. Vendors bring their equipment, they put it there. The number of Kenyans who use that, then SHA will reimburse those vendors based on the number of patients that go through. Honorable Speaker, on Mheshimiwa Jalango, in the journey of UHC, countries must make a choice. And I think he has left. Yeah. The choice is, if this House decides to say that we make healthcare free, then we have no problem. We will just create for you the budget. Now the amount we are spending on ECCIF, the amount this House has allocated, it's in its wisdom for PHC, is huge. So if we say that we share, but that's why we cap the chief payments on the income, that we pay more those of us who are at the apex, so that other Kenyans can benefit. And the principal goal is to reduce those ailments which are very catastrophic health expenditure, like cancer, like dialysis. Today, Kenyans can access dialysis, particularly majority who do twice a week. They are fully paid by SHA. You can walk to Aga Khan, and Honorable Speaker, we are opening a new center called East Africa Dialysis Center soon that will operate 24 hours, where even public servants can work during the day and they do their dialysis during the night. The drivers of this dangerous health expenditure, they include surgical packages and oncology. Maybe we need to look at those ones and see as a country what we can do. Honorable Speaker, I think finally the choice of a hospital will also decide the hospital bill. There are certain hospitals, and I want to make it very clear, that they want to make money. You go to some of them, they have got, they charge you the TV, they have a private wing, they charge you their insurance. All those is lumped into the cost of healthcare. So if you go to a private wing of Nairobi Hospital, you'll pay more. But if you go to the private wing of Kenyatta National Hospital with more consultants, better. And I've seen many leaders now are going to Kenyatta Hospital and Kenyatta University Hospital, MTRH. If you go to those referral hospitals, public referral hospitals, you can get, even if you compare even the private, Aga Khan versus Nairobi West versus Nairobi, do your own analysis. So it depends on the choice of the hospital. But we have done an analysis and we have found out that surgical expenses are the drivers of healthcare costs in our country. And Honorable Kibagedi, I can assure you that we will not politicize, but we will just want to give the country the true situation. And we get a lot of feedback. In our call center run by Safaricom and Digital Health Agency, the number and the questions Kenyans ask are close to between 5,000 to 10,000 every day. Even now you can call. Total cost of the benefit package that was financed purely from the exchequer, if we have to say that healthcare will be free in our country, will be close to about 410 billion shillings per year. I mean, that is the reality. And the bed rebate, if you go to level 4, finally, Honorable Speaker, if you go to level 4, the bed rebate is 336. If you go to level 5, it's 392. If you go to level 6, it's 448. 50% of that is an increase from the previous NHIF. Thank you, Honorable Speaker.
Thank you, Honorable Speaker, and thank you, CS. For every information, myself, just like all other members, believe in SHA. But then, there are the small health centers in the village, which really assist the people on a daily basis. In my constituency, there are many of them. We have a Sirulo, we have a Musire, we have a Matsuli, we have many of them, including a Lukongo. And I'm one of the people who often gets feedback to the minister. Honorable Speaker, they have never received any SHA monies. And their SHA monies, because they come and talk to me, are small, but they have never received, like a Sirulo, a Matsuli. So they are really surviving. Yet these are the first places where the patients go to in the village. And the village setup is a very difficult setup. Could you speak on this? That why would it happen that since you began, the small health centers have not received? And I'll be more than willing to give you the full list before you go away. Thank you, Honorable Speaker.
Honorable Speaker, if I'm given the list like St. Mary and Consolata, we pay everybody. Primary health care, level 2, level 3, and sub-county hospital, under PHC, we have paid 9.8 billion, 13 months. If I am given the list, before I finish, if you give us right now, before I leave the house, Honorable Speaker, I will give the Honorable member how much we have paid those facilities. Just right.
Honorable members, we are now at 6:18. I have 4 questions to go from Honorable Karani, Kawanjiku, Naisula, and Kwenya. Kawanjiku has already had 2 bites. Minister, if I skip Kawanjiku, can you answer the remaining 3 questions in 30 minutes? Minister, if I skip Kawanjiku's question 77 for another day, he has asked 2 questions already. Can we do the remaining 3 from Karani, Honorable Kwenya, and Naisula in 30 minutes? Yes. We can. Yes, Kwenya, what's your suggestion?
Mr. Speaker, most of these questions that we have raised are interrelated, and actually,
completely, yes.
Based on the responses that we're getting from the Speaker, I would wish that maybe we read them out, all of us, then we can have responses from the CS. If we have further questions, then we can engage as we're doing.
Then even Kawanjiku will be in the net. Let's start. Stephen Karani.
Minister, record all of them, and you'll answer them in 30 minutes.
Thank you, Mr. Speaker. I stand to ask question number 75 for 2025. Can the Cabinet Secretary explain why informal sector workers are no longer able to remit monthly contribution to the Social Health Insurance Fund SHIF under the Social Health Authority SHA, including being required to make top-up contributions when they are receiving medical services from hospital, creating discrimination as this requirement is not imposed on salaried individuals. Number two, can the Cabinet Secretary
Order, Nabulindo and Oundo. This is not a market in your region.
And the Cabinet Secretary clarify whether any assessment has been undertaken on the impact of requiring annual contributions from informal sector workers on their right to access affordable health care. And finally, number three, outline the alternative payment models accessible to informal sector workers and measures put in place to ensure inclusivity and flexibility in the remittance of SHIF. I thank you, Mr. Speaker.
Could the Cabinet Secretary A provide a report on the number of Kenyans that have registered with the Social Health Authority, including measures taken by the Ministry to sensitize the public on payment of premiums and the benefits available under the package offered by the authority? Question 2, clarify on whether indigents are subjected to a means testing process, and if so, provide a report on whether claims by indigents have been fully paid for and the number of indigent households that have benefited under SHA. 3, outline the current uptake of premium financing and the utilization of the Lipa Pole Pole scheme under SHA for Kenyans in the informal sector. Number 4, provide the status of recruitment by the SHA and whether staff of the defunct National Health Insurance Fund, NHIF, have been transitioned to the authority. Number 4, indicate the status of the suspension and investigations of health facilities that had integrity issues, including actions taken by the ministry to resolve the matter and ensure accountability by the health facility. Number 5, clarify whether the Lulo and Urban Private Hospitals Associations, RUFA, allied facility are accepting and treating SHA members in their facility. Thank you, Honorable Speaker.
Naisula.
Thank you, Speaker. Could the Cabinet Secretary outline measures put in place to ensure the provision of quality healthcare services and patient safety in health facilities, including the manner in which pre-authorization for admission and procedures is done by the Social Health Authority? Clarify whether the Ministry of Health, the Social Health Authority, and the Kenya Medical Practitioners and Dentists Council conduct inspections of the contracted health facilities to ensure strategic purchasing of services and that SHA members receive quality healthcare services. State measures put in place to ensure availability of drugs in healthcare facilities by Kenya Medical Supplies Authority, including improving the institution's order fill rate and ensure uninterrupted supply of drugs. 4, explain the relationship between the Social Health Authority, the Digital Health Agency, and the Kenya Medical Practitioner and Dentist Council with regard to updating of bed capacity, empanelment, pre-authorization, claim settlements, system downtime, and surgical reviews. Explain why the Social Health Authority Tribunal has not been operationalized, and explain how disputes in relation to billing disputes, claim rejections, and closure of facilities are being handled by SHA, KMPDPC, and the ministry. Clarify whether Kenyans may seek medical services outside Kenya under the Social Health Insurance Fund, and if so, provide the procedures that are to be followed for getting approvals to be treated outside of the country by the Social Health Authority. Lastly, Mr. Speaker, can the Cabinet Secretary provide a report on the manner which the Social Health Authority empanels and pays health facilities outside of Kenya? Thank you, Mr. Speaker.
Kwenya.
Could the Cabinet Secretary explain what it entails the Linda Jamii program, including whether there are any benefits categorized for maternal, newborn, and child health. Provide report on the statistics of teenage mothers and their children being treated at the Social Health Authority. State how much has been paid to facilities by the Social Health Authority at the Public Officers Medical Scheme Fund, including how much has been paid to the fund by the Ministry of Public Service. Outline the current status of NHIF outstanding, that is defunct NHIF outstanding debts, and the verification of the outstanding claims. Provide the reasons or grounds upon which SHA rejects claims, including whether such reasons are provided to health facilities, and the measures put in place to ensure that the 9,000 contracted health facilities are trained on claims, processing, SHA digital systems, and financial accountability. State whether SHA is paying for emergency services provided to Kenyans, and if so, explain how are the ambulances contracted by SHA, including procedures for referrals where ambulances are involved. Indicate the level of ambulance coverage in rural and far-flung areas of the country. Explain how the ministry is engaging and supporting county governments in the implementation of the Facility Improvement Financing Act, that's CAP 277. State the measures put in place to ensure that county laws are aligned to the national legal framework on facility improvement financing, and finally, outline the steps taken by the ministry to regulate organ and tissue donation and transplant in the country. Thank you, Mr. Speaker.
Minister, all those questions are largely overlapping, some touching on issues we have already dealt with. Could you cover them in the next 20, 30 minutes maximum?
Thank you, Mr. Speaker. Mr. Speaker, I also have a very comprehensive answer, which I have given to members. They can look at it, and I'm ready to engage them further. Honorable Karani was talking about why the informal sector and SHA, Lipa Pole Pole. I think all that together, if you put it, it tells you that the mean testing is working. And up to today, 1.8 million informal sector contributors have successfully registered, nearly doubling the previous annual enrollment rate of 51,000 individuals who are now actively. Every evening, 2,000 to 3,000 Kenyans go through the SHA Lipa Pole Pole, outside those others who pay through the informal sector, who go through the mean testing. Honorable Speaker, Honorable Kawanjiko is asking the same question I also answered earlier. How many Kenyans are registered as of 3rd of November?
Yes, Robert, what's the point of order?
Mr. Speaker, I've heard the CS allude to the issue of Lipa Pole Pole. Mr. Speaker, isn't it a fact that now anyone in the informal sector is supposed to pay annually upfront? That Lipa Pole Pole system was actually scrapped. Maybe he needs to clarify, Mr. Speaker.
Okay.
No, I think SHA Lipa Pole Pole is annual contribution. Honorable Mbui, I'll tell you, if you listen, I'll tell you. SHA Lipa Pole Pole means, first, there are Kenyans who pay through the informal sector who go through the mean testing, they pay annually. Now, when you go through the mean testing and your contribution is, for example, annually 6,000, and you don't have money, then SHA Lipa Pole Pole kicks in. It asks you, you pay 4 months. And the balance 8 months, you now use SHA Lipa Pole Pole. Will you pay daily? For 4 months, okay? You pay the 4 months, then it gives you a guarantee. There's no tax interest, there's no levies, there are no taxes. It pays for you the 8 months. Once it guarantees you to pay the 8 months, then the next question it is, do you want to pay the 8 months